Alzheimer's disease is one of the most common causes of memory loss in older adults, and millions of families around the world are affected by it every year. For many years, treatment options were limited, and most medicines could only help manage symptoms for a period of time rather than slow the disease itself. But researchers are now learning much more about how Alzheimer's develops, and this is opening the door to new treatment possibilities. One of the biggest areas of interest is the connection between cholesterol and brain health. Research has shown that high levels of unhealthy cholesterol may increase the risk of developing dementia later in life. Scientists believe cholesterol can affect blood vessels, inflammation, and the buildup of harmful proteins inside the brain. But lowering cholesterol may do more than protect the heart. Recent research involving hundreds of thousands of people found that lower the levels of unhealthy LDL cholesterol, lower the risk of dementia and Alzheimer's disease. Researchers also found evidence suggesting that cholesterol-lowering medicines may help reduce the chances of developing cognitive decline in some people. This does not mean that everyone should start taking cholesterol medicine to prevent Alzheimer's disease. But the findings are encouraging and suggest that controlling cholesterol may become an important part of brain health strategies in the future. Dementia is an umbrella term that describes a collection of symptoms, cognitive, functional and behavioral, that are caused by specific diseases. Alzheimer's disease is the most common disease that causes dementia. In simple terms, dementia is not only forgetting things as you age. But dementia is a disease-driven decline in the brain that severely disrupts a person's memory, communication, and ability to do everyday tasks. One cholesterol-lowering medicine receiving attention is called ezetimibe. This medication has been used for many years to help reduce cholesterol levels by decreasing the amount of cholesterol absorbed from food. Researchers discovered that ezetimibe may do something unexpected inside the brain. Laboratory research showed that the drug could reduce harmful protein clumps that are commonly seen in Alzheimer's disease. These protein clumps are believed to contribute to damage in brain cells and worsening memory problems. But the laboratory findings were only part of the story. While we are in the middle of the video, if you think this video is useful, click the like button and subscribe to my channel. It is a simple help to encourage me to make more videos. Researchers also examined health records from nearly 1 million older adults. They found that people taking ezetimibe appeared to have a much lower risk of developing Alzheimer's disease and related dementias compared with those who were not taking the medication. The results attracted significant attention because the reduction in risk was much larger than many experts expected. But it is important to understand that this type of research cannot prove that the medicine directly prevented dementia. Other factors may have influenced the results. That is why researchers are calling for large clinical trials to determine whether ezetimibe can truly help prevent or slow Alzheimer's disease. Another group of cholesterol-lowering medicines called statins has also been widely researched. Statins are already commonly used to reduce the risk of heart attacks and strokes. Several large analyses suggest that people taking statins may have a lower risk of developing dementia compared with people who do not take them. Researchers believe this may happen because statins improve blood flow, reduce inflammation, and help protect blood vessels throughout the body, including those in the brain. But scientists are still working to understand exactly how much protection these medicines may provide. Current evidence is promising, but more carefully controlled research is needed before doctors can recommend these drugs specifically for Alzheimer's prevention. Researchers are also exploring medicines that target the abnormal proteins found in the brains of people with Alzheimer's disease. Some newer treatments are designed to help remove amyloid plaques, which are one of the hallmark features of the disease. These treatments may help slow the progression of memory decline in selected patients when used early in the disease process. But they are not cures. People receiving these treatments still require ongoing medical care, monitoring, and support. Lifestyle changes also remain an important part of reducing dementia risk. Regular physical activity, healthy eating, good sleep, blood pressure control, diabetes management, and staying socially active may all help support long-term brain health. Research suggests that many dementia risk factors are linked to conditions that affect the heart and blood vessels. This means that taking care of cardiovascular health may also help protect the brain. But no single treatment can completely prevent Alzheimer's disease at this time. The best approach is often a combination of healthy habits, management of medical conditions, and early medical evaluation when memory problems begin to appear. Researchers around the world continue to search for better treatments and possible ways to prevent Alzheimer's disease before symptoms start. The growing evidence linking cholesterol and dementia offers a new and exciting direction for future research. If ongoing clinical trials confirm these findings, existing cholesterol-lowering medicines may eventually become part of broader strategies to reduce the burden of Alzheimer's disease. But until those answers arrive, patients should continue taking medications only as directed by their healthcare providers and discuss any concerns with their doctor. If you think this video is useful, click the like button and subscribe to my channel. It is a simple help to encourage me to make more videos.